After COVID-19, now a new virus emerging from China. Welcome to our channel, please subscribe and like our channel for more update. COVID-19 hasn't ended yet and here's another new virus found in China. Scientists are tracking a new, animal-derived virus in eastern China that has infected at least several dozen people. The novel Langya henipavirus, LayV, was found in 35 patients in the Shandong and Henan provinces. Many had symptoms such as fever, fatigue and a cough. They are thought to have contracted the virus from animals. There is no evidence so far LayV can transmit among humans. Researchers detected the virus predominantly in shrews. The discovery was highlighted in a letter written by researchers from China, Singapore and Australia and published in the New England Journal of Medicine this month. One of the researchers, Wang Linfa from the Duke News Medical School in Singapore, told China's state-run Global Times that the cases of LayV found so far have not been fatal or very serious, so there is no need to panic. However, Mr. Wang said, there is still a need to be alert as many viruses that exist in nature have unpredictable results when they infect humans. However, Mr. Wang said, there is still a need to be alert as many viruses that exist in nature have unpredictable results when they infect humans. The scientists said LayV was found in 27% of shrews tested, suggesting the mole-like mammals may be natural reservoirs for the virus. About 5% of dogs and 2% of goats also tested positive for it. Taiwan's Center for Disease Control said on Sunday it was paying close attention to the development of LayV. LayV is a type of henipavirus, a category of zoonotic viruses which can jump from animals to humans. Zoonotic viruses are very common but have attracted more attention since the start of the COVID pandemic. The U.S. Center for Disease Control and Prevention said scientists estimate that 3 out of every 4 new or emerging infectious diseases in people come from animals. The United Nations had previously warned the world will see more of such diseases with increased exploitation of wildlife and climate change. Some zoonotic viruses can be potentially fatal to humans. These include the Nipah virus, which has periodic outbreaks among animals and humans in Asia, and the Hendra virus, which was first detected in horses in Australia. Other related henipaviruses have also been found in shrews, as well as bats and rodents. A new type of animal-derived henipavirus, also named Langya henipavirus, LayV, that can infect humans has been found in East China's Shandong province and central China's Henan province, and has so far infected 35 people in the two provinces, according to an article published in the New England Journal of Medicine, NEJM, by scientists from China and Singapore. The new type of henipavirus was found in throat swab samples from febrile patients in eastern China with a history of contact with animals in recent times, according to media reports. Scholars who participated in the study pointed out that this newly discovered henipavirus, which may have come from animals, is associated with some febrile cases, and the infected people have symptoms including fever, fatigue, cough, anorexia, myalgia, and nausea. Further investigation found that 26 out of 35 cases of Langya henipavirus infection in Shandong and Henan provinces have developed clinical symptoms such as fever, irritability, cough, anorexia, myalgia, nausea, headache and vomiting. Henipavirus is one of the important emerging causes of zoonosis in the Asia-Pacific region, Shanghai-based media The Paper.cn reported, noting that both Hendra virus, HEV, and Nipah virus, NEV, from this genus are known to infect humans with fruit bats as the natural host of both viruses. Henipavirus can cause severe disease in animals and humans and are classified as biosafety level 4 viruses with case fatality rates between 40 to 75%, according to the data from World Health Organization, WHO, highlighting that this is much higher than the fatality rate of the coronavirus. However, there is currently no vaccine or treatment for henipavirus and the only treatment is supportive care to manage complications. The cases of Langya henipavirus so far have not been fatal or very serious, so there is no need for panic, said Wang Linfa, a professor in the program in emerging infectious diseases at Duke News Medical School who was involved in the study, adding that it is still a cause for alert as many viruses that exist in nature have unpredictable results when they infect humans. No significant spatial or temporal clustering of Langya henipavirus has been found till now, meaning that human-to-human transmission of the virus has not been proven, although previous reports suggest that the virus can be transmitted from person to person. Coronavirus will not be the last infectious disease to cause a pandemic worldwide, as new infectious diseases will have an increasingly greater impact on human daily life, Wang Xinyu, Deputy Chief Physician at the Department of Infectious Diseases of Huashan Hospital affiliated to Fudan University, said. Wang emphasized that the scope of this type of disease should not be limited to human diseases, but should be considered in a broader context, noting that the concept of One Health proposed by several international organizations in recent years is a suggestion and method aimed at sustainably balancing and optimizing the health of people, animals, and ecosystems.